Every single morning, millions of Americans over the age of 65 start their day with the exact same routine. You walk into the kitchen, pour a glass of water, and reach for that little plastic pill organizer. You pop a tiny tablet into your hand. Maybe it's a beta blocker, maybe it's a calcium channel blocker, and you swallow it without giving it a second thought. After all, your doctor prescribed it. It keeps your blood pressure numbers where they need to be. It protects your heart. You assume that once that pill goes down, its job is simple: keep you safe, quiet the background noise in your cardiovascular system, and let you go on living your life. But let me ask you a personal question. Have you noticed lately that your life feels just a little bit harder than it used to? Maybe you stand up from your favorite recliner after watching the news, and for 3 or 4 seconds the room tilts. You grab the armrest, shake it off, and think, well, I'm just getting older. Or maybe you go out into the backyard to tend to your garden, a job you've loved for 30 years. But after 10 minutes, your legs feel like heavy bags of wet sand. You sit down on the porch step, out of breath, telling yourself that your stamina just isn't what it used to be. Maybe your feet are freezing cold, even inside a warm house with wool socks on. Or maybe you've noticed your ankles looking puffy by late afternoon, leaving deep, painful indents where your socks band sat against your skin. What do most of us do when these things happen? We blame our birth certificates. We assume it's just the slow, inevitable creep of age stealing our energy, our balance, and our independence. We tell our children, "Don't worry about me, honey, I'm just slowing down." Here is the truth that very few doctors have the time to explain to you during a rushed 15-minute clinic visit. You might not be feeling your age. You might be feeling your prescription. Welcome to the invisible trap. What makes heart and blood pressure medications so tricky is that their side effects rarely show up wearing a name tag. They don't announce themselves like an allergic reaction or a sudden rash. Instead, they disguise themselves as ordinary signs of aging. They mimic fatigue. They look like poor circulation. They look like weakness, brain fog, or a bad night's sleep. Now, let me be crystal clear about one thing right up front. Beta blockers and calcium channel blockers are remarkable life-saving medicines. They prevent massive strokes. They reduce strain on failing hearts. They keep dangerous heart rhythms under control. This is not a video telling you to throw your pills in the trash or fear your pharmacy. But the safest patients aren't the ones who blindly swallow whatever's in the bottle. The safest patients are the ones who understand how the drug works inside their body, what signals their body is sending back, and when a subtle symptom is actually a warning sign that needs fixing. Today, we are going to unpack the quiet mistakes, the hidden interactions, and the silent side effects that millions of American seniors live with every day without ever realizing there's a solution. If you look at your prescription bottle right now, there is a good chance you will see a name ending in LOL. Metoprolol, Atenolol, Carvedilol, Bisoprolol, Propranolol. These are beta blockers, and they are among the most frequently prescribed heart medications in the United States today. To understand why a beta blocker makes you feel the way you do, think of your body as a car. On an ordinary day, when you face a challenge, whether that's walking up a steep driveway, feeling anxious about an upcoming doctor's visit, or chasing a playful grandchild around the living room, your brain steps on the gas pedal. It releases adrenaline and stress hormones. Your heart pumps faster, your blood vessels constrict, and a surge of energy pushes blood right to your muscles. A beta blocker acts like a governor placed directly on that engine. It blocks those adrenaline signals from locking into your heart cells. It effectively dims your body's stress response. As a result, your heart rate stays lower, your heart squeezes less aggressively, and your blood pressure comes down. For a heart that has been overworked, recovering from a heart attack, or dealing with an irregular rhythm like atrial fibrillation, this is a massive blessing. It gives the heart muscle a chance to rest and heal. But here is the flip side that so many seniors live with in silence. You no longer have access to that full surge of energy when you actually need it. When you try to climb that flight of stairs or carry a basket of laundry up from the basement, your body expects its usual boost. Instead, the medicine holds the engine back. Your pulse barely budges. Muscles in your legs begin to feel heavy, hollow, or exhausted because they are waiting for oxygenated blood that arrives at a much slower pace. You sit down completely wiped out, wondering why a simple household chore suddenly feels like running a marathon. And the physical slowing down doesn't stop with fatigue. Have you noticed your fingers or toes feel like ice cubes, even when the thermostat in your house is set to 72 degrees? That isn't just poor luck. Because your heart is pumping with less force and your overall circulation has softened, your body prioritizes keeping blood in your vital organs, leaving your hands and feet chilly. Others report bizarre changes at night. You lie down to sleep, but your dreams suddenly become strangely vivid, intense, or restless. Certain beta blockers can cross the blood-brain barrier, altering your sleep cycles and leaving you feeling groggy, unfocused, or emotionally blunted the next morning. Now, if you have type 2 diabetes or struggle with fluctuating blood sugar, pay very close attention to this next point because it could save your life. Under normal circumstances, when your blood sugar drops too low, your body sounds a loud internal alarm. Your adrenaline surges, your heart starts pounding in your chest, your hands begin to tremble, and you get a sudden frantic urge to eat something sweet. That discomfort is a protective siren telling you, fix this right now. But because a beta blocker mutes your adrenaline system, it can effectively turn off that siren. The racing heart doesn't happen, the noticeable tremor gets softened, the usual panic signal is quieted. A senior taking a beta blocker might experience a severe low blood sugar drop and have no idea until they suddenly feel confused, dizzy, or break out in a cold sweat. The early warning window is completely lost. If you take insulin or blood sugar medication alongside a beta blocker, you cannot rely on feeling shaky to know when your sugar is dropping. Regular monitoring with your meter becomes your most vital line of defense. If you aren't on a beta blocker, there's a very high chance you are taking a medication from a completely different family, known as calcium channel blockers. You might recognize names like Amlodipine, nifedipine, diltiazem, or Verapamil. To understand how these drugs work, we have to look at how your muscles contract. Every muscle in your body, including the muscular walls of your arteries and your heart, relies on calcium to tighten up. Calcium acts like the key that turns the ignition, causing muscle cells to contract. A calcium channel blocker simply blocks that key from entering the cells. When calcium can't get in, the muscles can't squeeze as hard. Your blood vessels relax, open up wide, and allow blood to flow through much easier. As those pipeline walls expand, the pressure inside them drops significantly. It's a brilliant way to treat hypertension. But within this single family of drugs, there are two distinct groups, and each one creates its own unique set of surprises inside a senior's body. The first group includes drugs like amlodipine and nifedipine. These focus almost entirely on widening your blood vessels. But when you open up those small vessels in your legs and feet, gravity takes over. By 4 or 5 o'clock in the afternoon, after you've been standing or sitting upright for a few hours, you might look down and notice your ankles look puffy, your shoes feel tight, your skin feels stretched, and when you pull off your socks, there are deep, painful indents left in your skin. Doctors call this peripheral edema, and what worries me is how many seniors panic when they see it. They assume their heart is failing or their kidneys are shutting down. They stop drinking water, they sit with their feet elevated all day, and they worry themselves sick. But in many cases, that swelling isn't because your body is holding on to extra water like in heart failure. It's simply fluid shifting outward because the blood vessels in your lower legs were forced to open wide. It is a direct physical result of the pharmacology of the pill sitting on your nightstand. The second group of calcium channel blockers includes drugs like Verapamil and diltiazem. These don't just relax blood vessels, they also slow down the electrical system of your heart and affect smooth muscle tissue elsewhere, especially in your digestive tract. Calcium is what keeps your intestines moving food along through rhythmic, wave-like contractions. When Verapamil blocks that calcium, your gut muscle slows down to a crawl. The result? Severe, chronic constipation. For a senior, constipation is never just a minor inconvenience. A small slowdown turns into missed bowel movements, bloating, stomach pain, hemorrhoids, and a total loss of appetite. I've seen seniors stop eating meals simply because they feel like food is sitting in their stomach like a brick. They drink less water to avoid feeling full, which only makes the constipation worse. What breaks my heart is that many older adults suffer through this quietly, thinking it's just part of getting old. They buy over-the-counter laxatives, suffer in silence, and never mention it to their doctor, unaware that the heart pill they started 2 weeks ago is the real culprit slowing down their gut. Up until now, we've talked about side effects like fatigue, swollen ankles, and constipation as individual inconveniences. But when you combine these symptoms with how modern medicine is often practiced, a far more dangerous chain reaction can begin. In the medical world, this is known as the prescribing cascade. The prescribing cascade happens when a side effect from drug A is misdiagnosed as a brand new medical condition. Instead of recognizing that the first pill caused the problem, a doctor prescribes drug B to treat the side effect. Then drug B causes its own side effect, leading to drug C. Before you know it, a senior is taking 5 or 6 different prescriptions simply to manage the unintended consequences of the very first pill. Let's look at a classic example that happens every single day across America. A senior starts taking Amlodipine for high blood pressure. 2 weeks later, their ankles swell up. They go back to the clinic. If the doctor fails to connect the swelling to the amlodipine, they might say, "Looks like you're retaining water," and prescribe a diuretic, a water pill like furosemide or hydrochlorothiazide. Now, think about what happens next. The senior takes the water pill, they start running to the bathroom 6 or 7 times a day, they get dehydrated, their potassium levels drop, they wake up 3 times a night to use the restroom, leaving them chronically sleep-deprived. And because they are dehydrated and sleep-deprived on top of taking blood pressure medication, their blood pressure drops too low. This brings us to the single greatest threat these medications pose to a senior's life and independence: falls. Both beta blockers and calcium channel blockers alter how your cardiovascular system responds when you change positions. Normally, when you stand up quickly from a deep recliner, a hot shower, or your bed in the middle of the night, gravity pulls blood down toward your feet. In a split second, your heart automatically speeds up and squeezes harder to keep blood flowing to your brain. But if you are on a beta blocker or a calcium channel blocker, that rapid response system is muted. Your heart can't speed up fast enough, and your blood vessels can't tighten in time. Doctors call this orthostatic hypotension. In everyday life, orthostatic hypotension feels like a brief floating sensation. The room tilts. The edges of your vision go dark for 3 seconds. You grab the back of a chair, wait for your head to clear, and whisper to yourself, "Whoa, stood up too fast." In a 30-year-old, those brief dizzy spells are an inconvenience. In a 78-year-old, those 3 seconds of dizziness are a major medical emergency waiting to happen. In fact, studies show that a major fall is often the single turning point where an independent senior is forced to give up living in their own home. And so often, when we trace the story backwards, the tumble didn't happen because the person was frail. It happened because 3 different heart pills were quietly working together to rob their brain of blood pressure the moment they stood up. You should never have to trade your physical safety just to keep a blood pressure number low on a chart. As we near the end of our journey today, there are 2 crucial warnings every senior, caregiver, and family member in America needs to hear. These are the hidden traps that turn safe, effective medications into dangerous liabilities. The first trap is sitting right on your breakfast table: grapefruit. For decades, we've been told that eating fresh fruit is one of the healthiest habits we can build. But if you take certain calcium channel blockers, especially Verapamil, diltiazem, or specific formulations of nifedipine, grapefruit juice is a silent hazard. Here is why. Inside your small intestine, your body produces a special enzyme called CYP3A4. Think of this enzyme as a security guard at the border. Its job is to break down a large portion of your medication before it ever enters your bloodstream, keeping drug levels safe and predictable. Grapefruit contains natural compounds that completely knock out that security guard enzyme. Without that guard in place, far more of your blood pressure drug gets absorbed than intended. Your blood levels skyrocket. A normal daily dose suddenly acts like a double or triple dose. Your blood pressure can plummet unexpectedly, your pulse can drop to dangerously low levels, and severe dizziness can overwhelm you, all because of a healthy glass of juice at breakfast. Which brings us to what I consider the fatal mistake, the most dangerous thing a person can do when taking a heart medication. Imagine this scenario. You've watched this video, or you've spent weeks feeling exhausted, cold, dizzy, or bloated. You look at your pill bottle on the nightstand, feel frustrated, and decide, "I'm done with this stuff." You throw the bottle in a drawer and decide to stop taking your beta blocker cold turkey. Please listen to me very carefully. Never, ever stop taking a beta blocker abruptly. When you take a beta blocker for months or years, your body adapts to having your adrenaline receptors blocked. To compensate, your cells actually grow hundreds of extra receptors, desperately trying to catch any stress signals they can. If you suddenly cut off the medication, those extra receptors are suddenly exposed all at once. Your body experiences a massive, unchecked surge of adrenaline. This is called rebound hypertension. Your blood pressure can spike to crisis levels within hours. Your heart rate can race out of control, triggering severe angina chest pain, irregular rhythms, or even a sudden heart attack. Stopping a beta blocker without medical supervision is far more dangerous than the side effects you were trying to escape. So what should you do if you are suffering from fatigue, swelling, constipation, or dizziness right now? You become an empowered, informed patient. Starting today, keep a simple symptom journal. For 1 week, write down when you take your pills, when you feel tired, when your ankles swell, or when you feel lightheaded standing up. Take that notebook directly to your primary doctor or cardiologist. Say to them, "Doctor, I want to keep my heart safe, but these symptoms are stealing my quality of life. Can we check my dosage, review my drug list for interactions, or try a different class of medication?" Modern medicine offers dozens of alternatives, timing adjustments, and safer avenues. You do not have to live in a fog, and you do not have to accept side effects as an inevitable price of getting older. Your prescription should protect your life, not steal your independence. Respect the signals your body is sending, partner with your doctor, and take control of your heart health today.